Hi there, welcome to this revision video on medicine in Britain 1250 to the present, including the historic environment of the British sector of the Western Front, 1914 to 1980s, looking at injuries, treatment and the trenches. This is an exam walkthrough video, so we're going to take you through how to answer an exam question on this topic. So here's an overview of the exam questions. The section A is on the historic environment. You've got a question 1, a describe two features question. Question 2A is a how useful are two historical sources, source A and source B. Question 2B is how could you follow up one of those sources, thinking about a historical inquiry. And then section B is medicine in Britain, 1250 to the present day. There's a question 3, which requires you to look at a similarity or difference across the course. Question 4 is an explain why question. And then question 5 or 6, you've got a choice for this one, is a how far do you agree question. So let's look at the questions in more detail. Okay, so section A, you have to answer questions 1, 2A and 2B, and this is on the historic environment, which is the British sector of the Western Front, 1914 to 1918. So question 1 is a describe two features question. So we're going to look at the example question, describe two features of blood transfusions on the Western Front during the First World War. In terms of answering this question, you must give two distinct separate features. So think about the first feature and then the second feature. You get 1 mark for identifying the correct feature and another mark for supporting evidence. So it's quite useful when you're thinking about this question to think about writing 2 sentences. The first one describes the features, you can see there down in the top tips, and the second one gives additional supporting evidence. This question is purely testing your own knowledge. You don't particularly need to analyse the feature. So let's have a look at the first feature. Blood transfusions on the Western Front were carried out using a syringe and tube whilst the blood donor was present. This stopped the patient going into shock from blood loss. Second feature, before the Battle of Cambrai in 1917, a blood depot was set up. This showed the army developed new ways of coping with large numbers of casualties on the Western Front. So there's a couple of example features there. That question there, that answer would score you 4 marks. Okay, so let's move on to look at question 2A. Okay, so question 2A is the usefulness question. It's the same type of question that you will get on the paper 3 exam, where you've got sources and interpretations. So question 2A is focused on a specific inquiry. You'll be given 2 sources to answer this question, and you need to begin by studying the 2 sources for question 2A really carefully. So let's have a look at this question. So the question says, how useful are sources A and B for an inquiry into the treatment of battle injuries by medical staff on the Western Front? Now, what I would be doing in terms of decoding the question is underlining that part of the question where it says treatment of battle injuries by medical staff. So that's the kind of inquiry we're looking at. And then we're thinking, okay, how useful would these sources be for answering that question? And then the question goes on to say, explain your answer using source A and B and your knowledge of the historical context. And that's absolutely crucial as well. So a couple of things you want to identify when you're reading or looking at the sources, if you get a photo, is what's the provenance of the source. So where does it come from? Who wrote it? What's its purpose? What's the audience? And then what's the content? So what can you actually see within the source? So this source is a photograph showing a British casualty clearing station on the Western Front circa, which means around 1916. And we can have a look at that picture in a bit more detail, and we can see here we've got a couple of nurses that are clearly treating these soldiers, and they're kind of like walking wounded for the most part. These soldiers, they've probably got minor injuries. We can also see a medical orderly just in the sort of far right of the picture, tending to that soldier who's got a bandage around his head. So these are basically soldiers that are being patched up, and they're not the major injuries. Behind you can see a tent, which would have been where the major injuries might have gone into the actual tent itself. Okay, let's have a look at source B. Okay then, let's have a look at source B. It's from a nurse at the front, the First World War diaries of Sister Edith Appleton, by Edith Appleton of course. Edith's handwritten diaries were kept by her family until they were published in 2012. She was a trained nurse working at a military-based hospital in northern France. Here, Edith is describing the arrival of wounded soldiers at the hospital during the early days of the Battle of the Somme, 1916. So there's quite a lot in that provenance, and there's a few things there to pick out. Obviously, Edith was a nurse who was at the front line. She was a trained nurse. These diaries, though, were basically kept by her family in private until they were published in 2012. Also, it's really significant to know that she's described in the early days of the Battle of the Somme in 1916. And the events here are from some of those first couple of weeks of the Somme, where we know the fighting was really, really brutal. So July 4th, wounded, hundreds upon hundreds, some on stretchers, some being carried and some walking, and all covered from head to foot in mud. We had to deal with large numbers of horribly bad wounds. Some were crawling with maggots, while others were stinking and full of gangrene. One poor lad had been shot in both eyes. 3 men had died on the way to hospital, and 2 died before they could be treated. The surgeons, July the 8th, the surgeons are amputating limbs and boring holes into skulls at the rate of 30 a day. July 13. I fear one boy may not get better. He has pneumonia caused by a lump of metal in his left lung, and I suppose they will not be able to operate on him. So again, you need to think about what is going to be useful about the content of the source and what's useful about the provenance of the source for this question. Okay, so building on from that, one of the things to think about for this question is you need to think about content, provenance, and knowledge, and that's really, really important to think about. So when you're looking at content, try and think about how useful the content of the source is. Pick out quotes from the source, make inferences about what would be useful for a historian in looking into this inquiry. In terms of provenance, study the provenance, think about the purpose and audience, how might that be useful? Avoid generalizations such as the source is biased, so it's not useful. And then knowledge, does your knowledge suggest the source is accurate and complete? And you're going to really tie this in with the content. It doesn't need to be that detailed. One piece of specific knowledge can be enough to explain how useful the source is. Now, bearing in mind, you have to look at 2 sources. So in effect, each source is kind of worth 4 marks each. You don't need to write absolutely loads for this, but what you do need to make sure is that within your answer that you are addressing these 3 different aspects of the question: content, provenance, knowledge. And that's really, really good guidance in terms of how to approach this question. So let's look at how we actually might answer this question. One thing when you're answering this question is to remember you need 1 paragraph for each source. There is no need to compare the 2 sources. There's no need for a conclusion. Analyze how useful the source would be. Try and use phrases like this: was very useful, quite useful, extremely useful. Don't start off by saying the source shows or the source tells me. Start off by saying the source is very useful, quite useful. Use contextual knowledge to explain how useful it would be. Now, contextual knowledge is knowledge that helps you to understand the sources and put them in context. It must be additional knowledge that helps explain how useful the source is. You can't simply say, I know this is true, because you're not providing any additional knowledge on top of what's in the source. Make a judgment how useful each source would be, and you can do that within your first sentence: highly useful, extremely useful, quite useful, etc. So let's look at source A. So what I've done here is I've color-coded it for you where we're addressing content, provenance, and knowledge, so you can really see that you're kind of looking for 1 or 2 sentences around each of those different areas to pick up the marks for this question. Source A is highly useful for an inquiry into the treatment of battle injuries by medical staff on the Western Front, because a historian could use it as evidence of the types of injuries soldiers experienced and how nurses were used to treat a wide range of injuries such as head wounds, foot wounds, and broken bones. This suggests nurses were able to treat many minor injuries, whilst major injuries may have been treated in the tent behind. The fact it is a photograph suggests it could well be an accurate record of the scene. Its purpose may have been to reassure people that injuries were treated, but the fact it focuses on minor injuries might not be fully representative. The source might be misleading and less useful, as I know from my knowledge that although it looks like the wounds are being treated, many developed complications such as gangrene or infection, which, without antibiotics, could have led to serious illness and even death. So that is exactly how you can approach the question. Okay, some nice specific knowledge at the end there to analyze how useful the source is. Okay, so same thing for source B. We're looking at content, provenance, knowledge. Source B is also highly useful for telling us about the treatment of battle injuries. For example, the source suggests there was a wide range of injuries, and that injuries often led to complications such as the soldier developing pneumonia caused by a lump of metal, presumably some shrapnel. Furthermore, the fact that it was produced by Edith Appleton, a trained nurse, would be really useful as she updated her diary regularly, making it a really useful first-hand account of the realities of war. In addition, my own knowledge supports the fact the increased use of high explosives at this stage of the First World War led to more head injuries. In addition, I know base hospitals treat the worst injuries, meaning Appleton may have a slightly misleading impression of the war injuries. So that, again, is an example answer. There's other things you could have picked out from that source. There's absolutely loads from that source B. You could have picked up on the fact it was a private diary, so that might make it more accurate. You could also talk about how the Battle of the Somme was one of the worst battles, so therefore it might not be give a completely accurate impression of the types of injuries that medical staff treated on the Western Front. Okay, so question 2b is worth 4 marks, and the question is, how could you follow up source A to find out more about the treatment of battle injuries by medical staff on the Western Front? In your answer, you must give the question you would ask and the type of source you could use. Complete the table below. So this is the source that we've already seen. So you've already analysed this source. It's the photograph showing a British casualty clearing station on the Western Front. Now, some top tips for this one. The starting point for this question is to think about the detail in the source you want to follow up. So you need to pick out some detail of the source. If it's a written source, you're going to pick out a quotation. But in a picture source, a photo like this one, you're going to need to pick out a specific detail from that source. Then you need to pick something that a historian could base an inquiry around in terms of your follow-up. And once you've done this successfully, the rest of the answer will flow. You just need to think about a specific source. So you should have some good awareness of different types of sources from your learning in class. And then you need to think about how that source would actually help answer the question. The way that you answer this in the exam booklet is basically they are giving you almost like 4 mini questions, and basically you get 1 mark for each aspect of the question. But there are some things where, for example, if your question, for example, doesn't link to the detail in the source, you're not going to get the mark for that. So you need to include a detail from source A to follow up. The question you ask must be a historical question. Try and think about linking it to a second order concept and make sure that it properly follows up that detail in source A. Basically, your question must be linked to the detail you selected. Think about a type of source and be really specific about this, and then explain how it would help answer the question. So this is an example answer that will get you 4 out of 4. So the photograph shows nurses bandaging the minor injuries of soldiers. The question you could ask, how were major injuries treated that needed surgery? So you're looking at a different aspect of it, but you're following up. So following up is kind of like you found out a piece of information. How can you take that further? The type of source, you could look at the Royal Army Medical Corps medical records. And how would that help you answer your question? The source would tell me about each patient's injury. I could find evidence of soldiers that needed major surgery, and the source will tell me what happened. Now, a common error that people sometimes make in this third point, the type of source, remember that source is information from that time period. So what you can't put down there is you can't say put like a history book or the internet or a school textbook, because they're not sources, they are historical interpretations. So it must be a source for that one. So that's how you do question 2b. Okay, so now you'll move on to section B. You've got question 3, 4, and then 5 or 6. Now, section B is on the rest of the medicine course. It's medicine in Britain from 1250 to the present day. So let's have a look at these questions now. Okay then, so question 3 is worth 4 marks, and it requires you to explain one difference or one similarity in medicine through time across 2 different time periods. So the question says, explain one way in which care in hospitals, so that's the key focus of the question, care in hospitals in the years 1250 to 1500 was different from care in hospitals in the years 1700 to 1900. So for this question, you're being asked to explain a difference, but sometimes it can be a similarity. You must make sure for this question you give examples from both time periods. Now, one thing that's important is that you are actually comparing. So use a connective such as if you're looking at difference, like whereas. On the other hand, in contrast. For similarity, you could talk about equally, similarly, furthermore. Remember, the question is about how they differ or how they are similar, not about why. So let's have a look at an example answer which will get 4 out of 4. In the years 1250 to 1500, care in hospitals tended to be carried out by monks and nuns who had little formal medical training. These kinds of hospitals, sometimes known as infirmaries, were often attached to monasteries and focused more on looking after patients and tended to provide herbal remedies. On the other hand, in the years 1700 to 1900, care in hospitals treated a wider range of illnesses and was carried out by trained doctors. Care even included surgical operations. So by 1700 to 1900, the care was much more advanced. Okay, so that's an example answer for question 3. Okay, so on to question 4 now. So it's a 12-mark question. This explain why question features on across the EdExcel exam in terms of paper 3 and also within paper 2 as well. So you should be aware of how to answer this question. So the question says, explain why there was progress in prevention of illness in the years 1700 to the present. You may use the following in your answer: Public Health Act 1875, healthy lifestyle campaigns. You need to write about 3 reasons. You need 3 aspects of knowledge essentially for this question. So you're looking for 1 paragraph for each factor that you're going to write about. Use the 2 bullet points to help you. Often people use the bullet points to help them kind of plan their sort of first 2 paragraphs, and then the 3rd paragraph is something from their own knowledge. It's really important to go beyond the bullet points. Don't just rely on the bullet points. Focus on knowledge and analysis, and there is no need for an introduction or conclusion. So let's have a look at an example answer. The first reason why there was progress in the prevention of illness was because of public health improvements in the late 19th century. Improved scientific understanding led to huge improvements. For example, John Snow was able to prove a link between dirty water and cholera during the Broad Street cholera epidemic in 1854. He used scientific methods to prove his theories. In addition, in 1861, Louis Pasteur produced his germ theory of disease. Once politicians and the general public understood that germs and dirty living conditions could cause disease, there was more pressure for politicians to make changes, leading to the 1875 Public Health Act. This was a crucial event as it forced local councils to provide clean water and remove sewage and help bring about the end to the cholera epidemics. This shows that improved scientific understanding was a key reason for progress in the prevention of illnesses such as cholera. Now, one of the top tips I've put at the bottom is to use phrases like "this led to," "as a result," "this meant that," "this resulted in." These are really good phrases to get practicing in terms of using causation language, because these are causation questions, and that really helps you to develop your analysis, and that's going to help you to pick up your analytical marks within this question. So let's have a look at this second paragraph. The second reason why there have been improvements in prevention of illness in the year 1700 to the present is because of the action the government has taken to promote healthy lifestyles. Government campaigns such as 5 a day have encouraged people to eat healthily, such as eating regular fruit and vegetables. In addition, the government has taken action against diseases such as smoking to promote healthy lifestyles. Although smoking hasn't been banned, the government has funded advertising campaigns to let people know of the dangers of smoking and taxes it heavily to try to reduce cases of cancer. In addition, in 2007, the government banned smoking in public places, which led to huge improvements. This was partly as a result of campaigns by the Roy Castle Foundation, who campaigned to raise awareness of the dangers of passive smoking in public places. Therefore, government campaigns and actions have helped to prevent illness. And you can see there another thing that we've done there, just the start and the end of the paragraph, is we've signposted and we quote the question in our answer, and that helps you to really stay tightly focused on the question, and that's going to help you pick up those analytical marks too. Okay, third reason that we'll look at now is, and remember, you want to get that really good knowledge in here as well, and knowledge is kind of key events, key dates, key names, for example. So let's have a look at this one. A third reason is the impact of vaccination campaigns throughout this time period, which has helped to prevent people from getting ill. Following Edward Jenner's discoveries on smallpox, the government passed laws making vaccination against smallpox compulsory. This has eventually led to complete eradication of what had once been a killer disease. Furthermore, the government has brought in vaccinations in the 20th century to tackle many diseases such as measles, whooping cough, and tuberculosis. This has meant there have been huge progress in preventing these diseases. Even recently, the vaccination work done against COVID-19 has meant that the COVID pandemic was brought under control relatively quickly, allowing a return to normal life. Therefore, the role of vaccinations have been crucial in the prevention of illness during this time period. So in a nutshell, you're looking for 3 paragraphs, essentially 3 key reasons, some good detailed knowledge, and some clear analysis using that causation language of "this led to," "as a result," "this meant that," etc. Okay, going on to question 5. So In terms of how to answer this question, you're going to evaluate historical interpretation given in the question. So let's have a look at the interpretation in this question. So the interpretation is there was little progress in understanding the causes of disease in the years 1250 to 1700. And then it's how far do you agree, and then explain your answer. Now you can use the following in your answer. They give you a couple of bullet points. They've given you the Great Plague in London of 1665 and the role of the individual Thomas Sydenham. Now there's no requirement to use the bullet points at all. You won't lose any marks if you never mention those. And obviously these questions are quite big questions. So there's a lot of information to draw upon within the time parameters of this question. Make sure, of course, that you stay within the correct time period. So you can't write about things in the 19th century, for example. You couldn't be writing about people like Louis Pasteur, for example, or John Snow, because that was in the middle of the 19th century. So, useful phrases to help you analyse interpretations, things like I strongly agree, I partially agree, evidence to agree with this view is that, this shows that, this means that, this meant that, the fact that, this gives weight to the view that, this provides evidence to support in the final analysis, I agree. These are all really good phrases to have in your locker when you're answering these questions. So let's have a look at how we could tackle this question. So, we're going to focus here firstly on quoting the question in your answer in terms of our top tips and signposting. You can see those blues sort of highlight that. So we're going to have a look, and the other key thing here is you need to have a balanced answer. So it's a good guide to do sort of like 3 key arguments. You could even do 4 key arguments, but make sure you've got a balanced answer. So you've got at least one that agrees and one that disagrees. So let's have a look at an agree here. There is much evidence to agree that there was little progress in understanding the cause of disease in the years 1250 to 1700. Firstly, people continued to use religion to explain causes of illness throughout this time period. For example, during the plague in London in 1665, people were soon using ideas such as praying and fasting in order to prevent the plague. In addition, people continued to believe in the idea of miasma during the plague in 1665, just as they had done in medieval times. For example, they burned barrels of tar in the streets. This shows there had been little progress in understanding the cause of disease between medieval times and 1700. Okay, in our second paragraph, I'm just going to focus on the use of analysis. So I've highlighted in here on green our use of good historical language. And again, we're going to agree with the statement again with another kind of key argument. So another piece of evidence suggests there had been little progress in understanding the cause of disease is that although some discoveries had been made, they didn't further understanding about causes. For example, there were discoveries in the Renaissance about anatomy and physiology from people like Andreas Vesalius and William Harvey. However, this led to improved anatomical understanding, not of what caused disease. In addition, old ideas persisted, such as the theory of the 4 humours. The fact that when Charles II was on his deathbed in 1685, one treatment they tried was bleeding him is crucial evidence. This shows that even the best doctors believed in the theory of the 4 humours, which is strong evidence to argue that there was little progress in understanding the causes of disease. Now, I really like the phrase, the fact that, and that really helps you to analyse evidence that you are looking at. Okay, we now need to make sure we do have at least one argument to disagree, so we've got that nice balanced answer. And we're actually going to use the prompt of Thomas Sydenham. Now, we've already gone beyond the bullet points, and it is crucial to go beyond the bullet points because we've used our example of the theory of the 4 humours. We've talked about miasma as well. So we have already done that, so that's fine. But we're going to use Thomas Sydenham as a prompt because he's a really helpful example of some progress during this time period as well. So on the other hand, there is evidence to contradict this interpretation as there were improvements in understanding the cause of disease. For example, Thomas Sydenham was an important individual who progressed understanding. He suggested ways to group types of disease and showed how to differentiate between measles and scarlet fever. As a humanist, he was starting to move away from religious causes and encouraging doctors to observe and look at each illness carefully rather than explaining all diseases through God. Sydenham reflects the wider decline in the Church's authority, allowing more scientific ideas and medical training to take place. Now, the yellow bits here show the specific knowledge that we've got here, and that's what we mean by knowledge. A key name, a key event, for example, a key word, okay, that type of thing, key date is what's going to pick you up the knowledge marks. Now you now need to finish off your answer with a conclusion. So when you think about a conclusion, some good historical language there at the bottom for you to draw upon. But I'm just going to show you an example conclusion. The big thing with the conclusion is make sure you don't sit on the fence. Make sure you give a really strong argument. So here's an example. In the final analysis, despite the fact that the authority of the church was declining and there were some new ideas such as the work of Thomas Sydenham, I strongly agree that there was little progress in understanding the cause of disease. Doctors and scientists had still not identified germs and had no real understanding of what caused disease. It would not be until the 19th century that Louis Pasteur proved that germs cause disease. Okay, so we're just going to look quickly at question 6. The advances in surgery made in the year 1700 to 1900 were more significant than advances in surgery made in the period 1900 to present. Explain your answer. You may use the following in your answer: antiseptics and transplants. So let's have a look at an example answer for this question. So in many ways, I agree that the advances made in surgery between 1700 and 1900 were more significant than those in the period 1900 to the present. For example, the development of anaesthetics was a highly significant development. This meant that surgeons could go deeper, be more precise, and patients were more willing to undergo surgery. This was a crucial development that underpinned all future surgical discoveries, as without pain relief, surgery was extremely challenging and only basic procedures could be performed, such as amputations. The discovery of anaesthetics like chloroform paved the way for even better and more reliable anaesthetics, which are still an essential aspect of successful surgery today. This provides strong evidence of the significance of advances in surgery between 1700 and 1900. Okay, another agree. Furthermore, I would also agree because in the late 19th century, antiseptics were developed. The development of anaesthetics had actually increased death rates because of the problem of infections leading to hospital gangrene or sepsis. Antiseptics were an absolutely pivotal discovery. Joseph Lister used carbolic spray to create a sterile operating room, reducing the deaths from operations from about 40% down to 3%. This shows that this was a highly significant advance. It led to the development of aseptic surgery as a technique to combat infection and kill germs within the operating theatre. This is still an approach used today, underlining its significance. You can see there we've got some lovely historical language which is really going to take your answer to the next level. So phrases like absolutely pivotal, highly significant, this shows that it led to, underlining. These are all really, really good phrases that you can learn and use within your writing. We now need an evidence to disagree, so we're going to look at the development of blood groups here in the 20th century. So on the other hand, there remain some significant challenges to successful surgery at the start of the 20th century. One such challenge that had not been overcome was the issue of blood loss. The discovery of the first blood groups by Karl Landsteiner in 1901 was an absolutely vital discovery. This led to the ability to perform blood transfusions. This was highly significant in allowing more complex operations to take place. In fact, multiple discoveries in the 20th century enabled more complex operations to take place. Techniques developed included skin grafting, plastic surgery, tissue typing, and keyhole surgery. Dr. Christian Barnard even carried out the first heart transplant in December 1967. Therefore, a key development of the 20th century was that much more complex and sophisticated surgery could be done. Now, if you see here, I've highlighted in yellow this time all the examples of really good knowledge. So key name, like Karl Landsteiner, a key aspect like blood loss and blood transfusions, a key date, 1901, a key event again with Christian Barnard and the first heart transplant. All really, really good examples of knowledge you can use. An example conclusion. In conclusion, I strongly agree. Don't sit on the fence. Make sure you do strongly agree or disagree. I strongly agree that advances in surgery in the year 1700 to 1900 were more significant than those made since 1900. Admittedly, there have been huge technological innovations in the 20th century, such as the first ever heart transplant. Despite this, none of this would have been possible without the foundations of anaesthetics and antiseptics in the mid to late 1800s. It's evident that these were the pioneering discoveries that paved the way for surgery to advance. And there you have an example conclusion. Okay, so that was an exam walkthrough for medicine in Britain and the historic environment of the British sector of the Western Front, focused on the exam board EdExcel's GCSE History. Hope that was useful. Thanks very much for listening. Goodbye.